Patients want to know, how does the GAE or genicular artery embolization procedure stack up against like the knee replacement surgery? And usually it's not an either or, right? There's a role for multiple different treatment options at different stages of a patient's problem. Both of these types of procedures, whether the total knee replacement surgery or the genicular artery embolization procedure, is really intended for osteoarthritis or knee pain that's caused by arthritis, and now the wear and tear of the knees is so bad that something has to be done. So usually the types of patients that are getting GA or getting offered are patients before getting considered for the knee replacement surgery, or patients who cannot have knee replacement surgery. So for example, one very common thing for orthopedic surgeons is to make sure that patients who are diabetic, that their sugar's under control. If their sugars are not under control and they put a bunch of hardware into the knee and it gets infected, it all has to come back out. So that's a big category of patients who cannot have a knee replacement that would be great candidates for the GAE procedure. On the other side, anesthesia. Some patients they're too high risk to go through anesthesia because the knee replacement surgery is a big involved surgery, and the risk of anesthesia, if it's too high, then the anesthesiologist would say no to the procedure for the surgery, in which case they would be a great candidate for the GAE procedure because it doesn't require general anesthesia and the risk is much, much less. The other type of patient, when comparing GAE to a knee replacement or knee arthroplasty, is the type of patient who's had a knee replacement. About 20% of the patients who have had knee replacements have pain that doesn't go away in some fashion, or has a new amount of pain that doesn't go away on its own. It's usually due to some inflammation after the surgery, in which case the GAE procedure could be a good procedure. And certainly before having to consider GAE, if a patient, or before having to consider a knee arthroplasty or knee replacement and having to go through all the rehab and all that, a lot of patients are just not wanting to go through having such a major surgery and the whole rehab with the knee replacement. And they're opting for the GAE procedure, which, can control the pain very effectively, and more importantly, doesn't reduce your chances of having a knee replacement. So let's say you do the GAE procedure and about 10% of the patients may not get significant pain relief from it. You've lost nothing. As far as it's not a risky procedure. If it doesn't work, you can always have a knee replacement procedure. But if it works, then you can avoid having a major surgery like knee replacement with all the rehab there's no rehab after the GAE procedure. So if you're comparing GAE with a knee replacement surgery, this is the trade-offs that you have to kind of consider. By all means, if you're considering one or the other, feel free to give us a call. We'll be more than happy to talk to you in more detail. As a patient, you have to remember you have a right to understand the risks and benefit of everything that's offered to you, but more importantly, alternatives. And this is where, a lot of healthcare providers may not know about the different types of alternatives. Sometimes there's more than one option available to solve a problem, and we try our best to make sure that patients understand all these different alternatives. There's a lot of information on our website about different alternatives and comparing different procedures. But definitely give us a call or make an appointment to come see one of us in our clinic, and we'll be happy to go over all this information with you. Take care.